Good evening, everybody. Right. Today, today we are going to talk about civic education. We are talking about the public services. My dear. Under that, we were discussing about water supply. Didn't we? Yes. We discussed about the water supply. Then I pointed out to you the reasons for increasing the demand of water. Yes, then we discussed about water supply, about the regional office, and so many things. Listen to me. Right. I think on the National Water Supply and Drainage Board, which is famous as the Water Board. National Water Supply and Drainage Board, which is known as the Water Board, is the, my dear, sole institution, the government institution, which is in charge of supplying water for the public as a public service. We have to pay money. They charge, the charges for the water supply. Anyhow, on the water supply was over. Today we are going to talk about health service. Health service කියන්නේ පුතේ සෞඛ්‍ය සේවයට and health service is the most important public service like education, because we know that we always need and require the services from the health factor. We know that there are government hospitals as well as private hospitals. So the government hospitals provide the health service free of charge. But private hospitals charge money expensively. Yes. Anyhow, you know that there are different types of sections in the health service. So when we get ill, when we are sick, we need medicine. Then we can go hospital and we can get the medicine freely from the government hospitals. Do you understand? Yes, the government allocates, the funds through the annual budget at the parliament for the health service. We know that the noblest wealth is health. The noblest wealth is health. Utum dhanaya neda nirogi sampathiya. And we want health service because we want a healthy nation. What is the main objective of the health service of a country? The main objective of the health service of a country to create a healthy nation, healthy generation for the country for future. If I am ill, sick, I cannot do my job. I cannot serve to the country. If your father is ill, he can't do the work for the society, country, and for the economy. He cannot continue the job. That's why we have to prevent from those sufferings and illnesses. Understand? Anyhow, my dear, we are going to talk about the health service. There are primary medicinal centers which are known as dispensaries. There are rural hospitals. There are regional hospitals. There are district hospitals. There are provincial hospitals. There are general hospitals. There are national hospitals. There are teaching hospitals. There are Ayurvedic hospitals. There are specific hospitals. Hospitals for cancer patients. Hospitals for kidney patients. There are different types of hospitals all over the country. In the country, we can get the treatments from the Western medicine. Western medicine, allopathy, Western medicine. And we can get the treatments from the local medicine, indigenous medicine, Ayurvedic medicine. We can get the treatments from Unani, Siddha, homeopathy. There are different types of treatments, not only the Western medicine, Eastern medicine, local and indigenous medicine, Ayurvedic medicine. We have different types of medicinal treatments. Operations, so many things there. The government provides the facilities for the health service. They develop the hospitals. They equip the hospitals with modern equipment. That CT machines, scan machines, X-ray machines, and other equipment which are very helpful for the diagnosis and examinations of the patients to prevent the public from the diseases. They launch different types of health camps, health programs all over the country, vaccination programs, immunization programs, freely to save the people from diseases. They always encourage the people to keep the environment clean. They visit the schools and encourage the children keeping their personal cleanliness. There are vaccination camps, immunization camps, injections are given for the children. The diseases like polio, leprosy, Baraga, filariasis, pneumonia, smallpox, chickenpox, measles, mumps, tuberculosis, ksharoga, sarampa, kambulgaya, vasuriya, AIDS, dengue, ඔය eradicate කරනවා, control කරනවා. මේ health service එකෙන්. There are doctors, specialists, surgeons, consultants, normal doctors, physicians, nurses, attendants, cleaners, drivers, ambulance drivers, laboratory technicians, a big staff who are ready to help the people. Right? We need medicine. We cannot live without medicine because always we work. Everywhere we get some, accidents. We need so many emergency care units, intensive care units, indoor treatments, outdoor treatments. I can tell you so many things. And we are going to study about that. Today, we can talk too much about typhoid fever. Just on that. Open your notebook and open your workbook also. Take both books on health service. Are the health service. Put the date first. On Thursday, 22nd January 2022. Health service. Underline the topic. Health service. Take the notebooks. Take the notebooks. Write the first question. What is the main objective of the health service on what is the main objective of the health service. Objective කියන්නේ පුතේ ප්‍රධාන අරමුණ on what is the main objective of the health service. What is the main objective of the health service? And let's write the answer. To create a healthy nation or generation for the country on to create a healthy nation or generation for the country is the main objective of the health service of the health service of the health service අනවුදේ හදවයිද Hi. Did you understand the main objective of the health service? Yes. Why do they? Why we need it? Because we need a healthy life. We need medical treatments and care. When we face the accidents, we need the emergency and intensive cares. That's why we need health service for the life every time. Alright. Okay. Next one. Take the book. Name the diseases completely eradicated and controlled by the government of Sri Lanka. Let's write. On the first one, mumps, kamulgai, mumps. It is very dangerous. Next one, measles, sarampa. Next one, polio. Next one, malaria. Next one, smallpox, vasuria. One. Next one, leprosy, laduru. These are the main diseases. No dengue, not eradicated. We have even today, dengue has not been eradicated yet in Sri Lanka. Puti. Tama eradicated tulana dengue. Dengue hamdan thinone. Onna mumps, kamulgai, measles, sarampe, polio, malaria, smallpox, pasuria, leprosy, laduru. ඒවා පුතේ සම්පූර්ණයෙන්ම තුරන් කරලා තියෙන්නේ. Understand? Completely eradicated. Eradicated කියන්නේ පුතේ removed. What is eradicated? Removed. On a removed. Completely removed. Removed Kerala. On හරිද? What is this පුතේ? Eradicated. Removed completely from Sri Lanka. Ever neither? Yes. Hari, what my idea? When I gave you some ideas about that, I told you about that. There are government hospitals as well as private hospitals. The government hospitals provide this service free of charge. But private hospitals charge money from the people. Anyhow, the health service is a very important and essential service for the better living conditions of the humans. That's why we need health service for our life. From it, at the end of March. Hari, Nena, you can understand this very well. On read the names again. On a polio, mumps, on a measles, smallpox, on a tuberculosis. What is that? Kshayaroga. When a cholera, malaria, leprosy, filariasis. You can barava. You can mention tuberculosis, cholera, and filariasis. Right. On the next one. On the cholera. And on cholera, tuberculosis, on a tuberculosis, on next one, on a filariasis. On Ujan, let's do that. Now you can write them again with the singular meaning. Write the singular meaning. Single thing on the mumps, kamulgai. On the measles, saramp. Leprosy, laduru. Filariasis. Smallpox. Tuberculosis. Tuberculosis. Cholera. Can you write the names again? Can you remember the names? Close the book. Now tell the names again. What are those diseases which have been eradicated, controlled or wiped out completely from Sri Lanka? First one, mumps, kamulga, it is very bad. Next, measles, saramp, smallpox, pasuria, tuberculosis, ksharoga. Next one, leprosy, laduru, filariasis, barava. Neither, cholera, malaria. Understand? Remember those things. Very important. Right? On my idea. Polio. Okay, they are dangerous diseases. They can kill you. They can make you disabled. Like polio. They can kill you. They are very dangerous like dengue. Like AIDS. AIDS. That's why the health service continuously gave you medicine. When you were born, you are given the first medicine, injections, vaccinations. As soon as you are born, at 1 day, at 1 month, at 2 months, 1 year, 2 years, 5 years up to, you are given the injections, vaccinations. Yes. To protect you from those diseases, to create a healthy nation. They are dreadful diseases. ඔයාගේ මොළයට හානි වෙනවා. නේද? hepatitis ඔයාගේ brain එක damage කරනවා. ඒ වගේ දේවල් හැදුනාම ඔයාව අංග විකල වෙනවා. ඔයා විකෘති වෙනවා. disable වෙනවා. leprosy හැදුනාම මේ ඇඟිලි හැලෙනවා. leprosy. You will missing your fingers, hands, your කුණු වෙනවා. මේ ඇඟිලි කුණු වෙලා හැලෙනවා. ඔයාගේ හැම දිය වෙනවා. ගඳයි. ළඟ ඉන්න බෑ. කැලේට ගිහින් දාන්න වෙනවා. leprosy හැදුනාම mumps හැදුනාම when you become a father you can produce babies. When you become a father, boys cannot give the birth to the boys. Really, baby. After getting married, you can become a father. Understand? We have to be careful. That's why those diseases were eradicated. That's why. Did you understand now? Right. You think what diseases can be listed like this. Now we are learning a very important part on the functions fulfilled by the health services. Take the notebook. Take the notebook and write the question. Example 2. Mention the functions of the health service. Mention the functions Now you don't have those diseases, then no need to talk about those things. But in the health lesson, you will be learning those things. When you study health, that's why I didn't talk about that. You have those lessons in health. Understand? And I forgot to tell you that sexual transmitted diseases also have been stopped. Sexual transmitted diseases also. I will talk about them later. AIDS and others. And functions duties and responsibilities. My dear. Duties and responsibilities. Duties and responsibilities. Responsibilities. Hi. What are the main duties of the health service? Now you can think about them. On the first one, providing health treatments, medicinal treatments and health cares for the people. No idea? Yes. Providing health cares and medicinal treatments for the public. Don't write. Second one, implementing. You can developing special vaccination and immunization programs for children and elders. I told you that. Right? Yes, very good. That's my idea. They organize different types of health camps and clinics to educate the public about unknown diseases. That is also the main function. And they maintain family life education. Family life education. Paul Saukya Adhyapane. Unfortunately, it is not taught for you. But in England, in America, in Australia, in Canada, in Europe countries, small children in grade 5, 6, they are taught about family life education. ඒකට කියලා දෙනවා. ගොඩාක් දේවල් සෞඛ්‍ය සම්බන්ධව. ඒ රටේ සංස්කෘතියත් එක්ක කියන්නේ නැත්තම් ඒ ළමයි නේද ලෙඩ හැදෙනවනේ. Then they launch different dental clinics for the school children in schools. And they control the dangerous drugs. ඒ භයානක බෙහෙත් තියෙනවා. ඒවා control කරනවා. They approve the medicinal doses. They organize some special health programs to stop and prevent some diseases like corona, dengue. ඒ වගේ මේ unknown diseases stop කරනවා. They provide medicinal treatments continuously for the people through hospitals. ගොඩාක් වැඩ කරනවා ඒගොල්ලෝ. දැන් තේරුණාද? We know of that the death rate of the small children and the death rate of the pregnant mothers have gone down because of the promotions of the health service. It was known as the infant mortality rate. Infant mortality rate. Babies' death rates. Maternal mortality rate. Maternal means pregnant mothers. Mortality means death rates have gone down in Sri Lanka. Very good. Health service කියන්නේ පුතේ ඔන්නෝම එකක්. On functions. We must write them one by one now in the book. Right, very good. Right? You are very good. Neither. Can I let's write them? Only one. First one. Implementing treatments implementing treatments for the public. Yes, Pute. Civic class. Implementing treatments for the public. Implementing treatments for the public. Second one, you can write now. Implementing programs to prevent and control the diseases. What you know about? Well, Afra. You can make your answers your own answers. No problem. I told you. Next one. Implementing of immunization and vaccination programs. On a vaccination program. Next one, implementing medical clinic for pregnant mothers and small babies. Pregnant mothers and small babies. Right? Small babies. Small babies. Next, carrying out. You can write yourself. Carrying out experiments to diagnose diseases. After checking still or either idea. Experiments are done, checkings are done to finalize the diseases, to diagnose diseases. Next one, launching medical and OPD means for the outdoor patients department. outdoor patients department OPD කියන්නේ I will tell you that what is OPD on OPD means outdoor patients right department OPD outdoor patients department. That means I will explain that. When you go to the hospital, sometimes you are admitted. You are admitted. When you are admitted, right? And now I am going to explain that. When you go to the hospital, sometimes you are admitted to the hospital. It is called indoor patients department. Indoor. But sometimes you are not admitted. You take the medicine and come home. It is called outdoor patients department, not a sector. Two systems of treating for the patient. Understand? You are given medicine. Sometimes you are given all the facilities, but you are not admitted. Then you can come home after taking all the medicine and facing for all treatments. That is called outdoor patients department. But if you are admitted, you can come home. You can go home. You have to stay there about a week under the treatments. It is called indoor patients department. There are two main treating systems. Understand? Right. OPD and neither. Did I explain the difference now? In the OPD, you can go hospital and take the medicine and again you can go home. But in the indoor treatments, you have to stay in the hospital till your ticket is cut, till you are released. The doctors come and check you every day. You are given meals. You are given all the medicines by the nurses. They look after you. But in the OPD, you are not given to drink medicine. You are just examined by the doctors and prescribe the medicine and you are given the medicine, then you can come home. Neither. Right. But in the hospital, indoor patient department, you are given full treatments. Full care treatments. That is the difference. That's all. Right. If you are seriously ill, you can go indoor. If you are not seriously ill, slightly ill, you can get for outdoor. Next. Launching medical and dental clinics for the school children. Launching medical and dental clinics for school children. Next one, Pute. Conducting on conducting medical clinics for pregnant mothers. We have written that. Right? Iranya. Okay, Pute. Then conducting family life health education programs. This is very important. Underline this and write that. Conducting family life health educational programs. You read and understand them. Conducting family life, health, educational programs. Okay. Family life, education. ඒ කියන්නේ පෞල් සෞඛ්‍ය අධ්‍යාපනය. පෞල් සෞඛ්‍ය. හරිද? පෞල් සෞඛ්‍ය ගැන කියලා දෙනවා. About the family planning, about the diseases regarding the mothers and fathers, family life. එකෙන් කියලා දෙන්නේ පුතේ family life ගැන. ඒ කියන්නේ පෞල් සෞඛ්‍ය ගැන. When your elder brother, elder sister gets married, a midwife comes to meet them. A midwife comes, public health midwife, and advises them, teaches them so many things. How to raise a healthy child, how to give a birth for a healthy baby. It is very important. How to give the birth for a healthy baby is very important. The public health midwife comes to that home and gives the advice for newly married couples. Understand now? Family planning. It is called family life health education. The family life education. පෞල් සෞඛ්‍ය අධ්‍යාපනය. Family life health education. පෞල් සෞඛ්‍ය අධ්‍යාපනය. ඒක හරි වැදගත් පුතේ. How to prevent from sexual diseases, sexual transmitted diseases. ඒවා කියලා දෙනවා. Right? ඔක්කොම කියලා දෙනවා. For newly married couples. ඒවත් කරගෙන යනවා. Health service again. ඒක වැදගත් නේ? Why? They want to create a healthy nation free from diseases. That's why. ඒගොල්ලෝ කැප වෙනවා නිතරම. හරි. You understand the functions of the health service of a country, implementing medical treatments, indoor treatments, outdoor treatments. I explained you. Launching different health programs to prevent diseases. නිකල් ඉඳලාකින් බලන්න ඕනේ අපෝ. Launching medical clinics, vaccination camps, immunization and injection camps for children and pregnant mothers. Always organizing health programs in schools to educate the children. They organize and launch health clinics to prevent from the very dangerous diseases like AIDS, dengue. ඒවා ගැන කියලා දෙනවා අපිට. වළක්වා ගන්න විදිය. Promoting family life health education on special care units, intensive care units. Again, accident වුණාම ගින්දානෝ ICU, intensive care units. That is අත්කාර ඒකකය. Emergency intensive care units. නේද? හදිසි සත්කාර ඒකක තියෙනවා. Intensive and emergency care units have been established in hospitals. They control the drugs. औषध පාලනය කරනවා. Operations කරනවා. අලුත් රෝග තිබුණොත් ඒවා හඳුනා ගන්නෝ වසංගත රෝග එතකොට new diseases තිබුණොත් ඒවා implement කරනවා and educate the public about newly discovered diseases අව උරුතලී තැහැක අපිට එහෙම කරනෝනේ වසංගත පාලනය කරනවා they try to control and eradicate those dreadful diseases like AIDS, dengue, malaria, cholera, typhoid, tuberculosis, whooping cough. ඒ වගේ නැති කරනවා. ඒ දීලා හරිම වැදගත් වැඩ ගොඩක් කරනවා ඒගොල්ලෝ. day and night operations බලන්න කරන සෙල්ලම්ද operations surgeries consultations on we also have a responsibility to respect them, to support them, to follow their guidance and advice properly, to protect the places, to develop them, to get the maximum use of them. අපිට තියෙන duties inwards. On my dear, the functions of the health service. පේනවා නේද? හොඳ තේරුම් ගන්න ඕන. On Hiranya is going to read the functions of the health service. Oh, Hiranya, read the functions of the health service.
Okay, sir. Functions fulfilled by the health services. We are going to explain the duties and responsibilities of health service. Treating patients, OPD, outdoor treating, bahira pratikara, indoor treatings, nevasika pratikara, implementing programs to prevent and control the diseases, implementing of immunization programs, implementing medical clinics for pregnant maternity and infancy, carrying out experiments to diagnose diseases, launching medical and dental clinics for school children, conducting medical clinics for pregnant or maternity and infants, conducting family life health education programs. Thank
Very good. පුතේ ඔන්න these are the main functions. ඔබ ආරම්භ කරන්න ඕනේ පුතාලට. හිතලා ලියන්න තමයි සර් කියලා දුන්නේ. I gave the note. note එකක් දෙන්නත් බෑ බලන්න කියවන්න ටිකක්. That's why the notes were given. But I gave the question on the board to let you write yourself. එහෙම තමයි ඉගෙන ගන්න. In European countries, they have open test, open book test තියෙනවා. පොත් බලන්න ලියන්නත් පුළුවන්. එහෙම විභාගයක් තියෙනවා. පොත් බලන්න ලියන්නත් ඉගෙනගෙන තියෙන්න ඕන. පොත් බලන්න ලියන්නේ කොහොමද? පාඩම් කරන්නේ නැතුව. තේරුම් ගන්න. පොත් බලන්න ලියන්නත් හොඳට ඉගෙන ගන්න බෑ. එතකොට ටිකක් ලියන්න පුළුවන්. තේරුණේ? right. ඒ open book test. අපි ගාව තියෙන closed book test නේ. හරි. ඉතින් පුතේ ඔන්න we are going to talk about different medical systems which are practiced in Sri Lanka. Write the question. Name different medical systems which are name different medical systems which are practiced in Sri Lanka. On name different medical systems which are practiced in Sri Lanka. What are they? I told you. Don't write. Look at the teacher's note. On the main one, West Western medicine. The first one, Western medicine. Doctors have the stethoscopes. Doctor Western medicine. They go to medical college. ඒකට අපි කියන පුතේ allopathy කියලා. On allopathy. දැන් අහන් ඉන්න ඕන. Second එක පුතේ local indigenous on indigenous medicine. Indigenous medicine. Indigenous medicine කියන local. ඒකට අපි කියනවා Ayurvedic treatments in our country. Listen to me. At the beginning, before the Western medicine was introduced, yes. එතකොට දැන් අහන් ඉන්න හොඳට අහන් ඉන්න ඕන. පුතේ, before the Western medicine was introduced, Sri Lanka was consist of Ayurvedic treatments, indigenous medicines. අපේ රට පිළිලා තිබුණා indigenous local medicine systems වලින්. ඒ තරම්ම powerful curable medicine systems තිබුණා. When we go to the jungle, when we go to the down of the garden, when we go around the house, we could find hundreds of more valuable herbal plants. එහෙම නේද කියන්නේ? අදත් එහෙමයි. Even today, we can find thousands of, hundreds of valuable, more curable medicinal plants, herbal plants in our home garden. If you live in a rural area, not in the town, අදත් ගම්වල ඕන තරම් ඖෂධ තියෙනවා. ඒවා හරිම බලවත්. හැබැයි මේ වෙස්ටර්න් මෙඩිසින් එකත් ඒක නැති කරා. අප පුරුදු කරා ඔය බෙහෙත් පෙත්තටයි for the pill and the capsules and the syrup. But earlier we used to eat them after making porridge, කැඳ හදලා, making some sambal, නැත්නම් making curries, නැත්නම් making herbal drinks. හදලා අපි බිව්වා. එහෙම නේද? අපේ මුතුමිත්තෝ. They were healthy. They lived around 120 years. අවුරුදු 120ක් ජීවත් වුණා ඒගොල්ලෝ. නේද පුතේ? herbal plants තියෙනවා නේද පුතේ? Very good සුදු. අන්න හරි බලන්නකෝ. That's why I told you. පුතේ, in the ancient villages, they didn't have the cement walls. They had fence. වැටක් තිබුණා. ඒ වැටේ තනිකර තිබුණේ මොනවද? බෙහෙත් පැලෑටි. තේරුණාද? බෙහෙත් පැලෑටි. ඇහැට දානේවා, සෙමට කනේවා, සුගර් කනේවා, ඩයබටිස් හදලාම කනේවා. එහෙම තිබුණේ. But today we don't have those plants and we don't eat, we don't know the names of those plants because of the Western medicine. But foreigners come to Sri Lanka to get pepper, to get gumbo, coriander, cardamom, cloves, cinnamon, saffron, ginger, and king coconut. Apparently, they were. These are turmeric, powerful. Is it? Hatavari again was ingredient. Asparagus, Hatavaria. Centella, Gotukola. Centella, the Canada. On so many things there. Udatevaldino, aloe vera, I think over Tribuna. The best medicinal system is Ayurvedic medicinal system. It is eco-friendly. It is very, actually called best medicinal system. But Western medicines are quick, but not permanent. Quick, but not permanent. Ayurvedic medicines are not quick, but permanent. Step by step, we get the recovery. Best medicine එක තමයි Ayurvedic medicine. ඕනකෙනෙක් දන්නවා. We can drink the porridge. කැඳවන්න පුළුවන් අපිට. එතකොට අපි ඔක්කොම විටමින් අපිට හම්බ වෙනවා. Western medicine based on the antibiotics. Antibiotics විතරයි තියෙන්නේ. හැබැයි antibiotics නෙමෙයි Ayurvedic medicine තියෙන්නේ. vitamins තනිකර. ඕක තේරුම් ගන්න ඕන අපි. ඔන්න නේද local indigenous medicine තියෙනවා. යුනානි තියෙනවා. සිද්ධා තියෙනවා. homeopathy කියලා තියෙනවා. homeopathy කියන්නේ Chinese system එකක් නේද සුදු? කටු ගන්නවා පිනිලවලට. There are some places, sensitive places. Those sensible places are pierced with needles. Needles and treatments are given with the needles for the senses in your body. Then you get the treatments. Where treatments through the senses, very important. You take your finger, there are some sensors for the brain, eyes, everywhere. You take the foot, the thumbnail for your eyes, brain, foot. But today we use the slippers and shoes. But earlier, those humans didn't use the slippers. So they had a good eyesight. But today we can see. We want spectacles. Why? We don't walk keeping the bare foot. If you walk with the bare foot, you will be healthy. අද අපිට bare foot යන්න බෑ. Everything බෑ අපිට slippers නැතුව. Slippers ඕන අපිට everything. දැන් මොකෝ උනේ? අපේ ඇස් පේන්නේ ලෙඩ වෙලා අපි. ඉස්සර එහෙමනේ. People didn't use slippers. ඔය තමයි ඇත්ත කතාව. මේකෙන් සුදු කියන්නේ. හරි. Yes. And Nidu. Let's write those names now. And Budal Liagan Sunday. Write number 1. On a Western. On a indigenous. On a Siddha, Unani, homeopathy. On a Western. Allopathy. Indigenous. 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 Hey, look, yesterday on Western means allopathy or medical systems. Indigenous medicinal, at the medical system. Siddha, Unani, homeopathy. That's all. Okay. There are different types of hospitals in Sri Lanka. In very small villages, very small and remote villages, there are primary medical centers. They are called dispensaries. A doctor comes, visits that place twice or thrice a week and gives the medicine for the people of that place. We can see primary medical centers in those very rural areas. There are village hospitals. They are called rural hospitals. There are base hospitals, regional hospitals, district hospitals, provincial hospitals, general hospitals, teaching hospitals, national hospitals, specific hospitals. They are special for the eye patients, kidney patients, cancer patients, for small children. Neither. Dispensary. And one, the government has, and the government provides funds to develop those things, to maintain those things. The government widens, develops the facilities and the buildings of these places for the use of the public through the taxes of the public, which are paid by the people. You know of that. We have to protect them because they give the life. They give you life. They protect your life. Medicine can life protect another. And you can name different types of hospitals in Sri Lanka. They are not given, but very important. Can I write the question? What are the different types of hospitals in health service? Let's write neither. And write soon. What the first one? National hospitals. Right, so national hospitals, teaching hospitals, provincial hospitals, district hospitals, base hospitals, regional hospitals, dispensaries, dispensaries, primary medical centers cancer hospital kidney hospital children's hospitals children's hospitals kidney hospitals cancer hospitals. There are different types of hospitals. Different types of hospitals. ඔන්න පුතේ hospitals මාර්ග නේද මයිඩි? හරිද? right ඉතින් ඔන්න health service කියන්නේත් හරිම නේද පුතේ? very important part of the public service. Right? Health service. Right. Putte, in the ancient village in Sri Lanka, there was Ayurvedic home. There was a medicinal center. We have heard that King Buddhadasa had appointed a physician each. Yes. For, each 10 villages. Historical records have revealed that. So we can understand about that. They are not the Western doctors. They are Ayurvedic doctors, indigenous medicinal treatment doctors. I was talking about the ancient villages in Sri Lanka. Each and every village had a medicinal center in a home that was called Vedagedara, indigenous medical home. That was an indigenous medical home. There were so many different types of medical officers in the past. For eyes, for the whole body, for snake, yes, for other animals. They had known medicine very well. But today, we don't have such knowledge. A knowledge but China have. China have protected that. Japanese have. Do Japanese have Western medicine? No. Do Chinese have Western medicine? No. Understand? They have their own developed medicine. They produce medicine themselves. They have produced all the machines. And he is called indigenous doctor, Ayurvedic doctor. එහෙම කාලයක් තිබුණා පුතේ රටේ. අද ඒව නැහැ. තේරුණාද? අද ගමේ එහෙම එකක් නැහැ. Right. Okay, or last part of that. There are some Ayurvedic medical centers also. No need to write that. I just gave that. Ayurvedic. It is also very powerful. we actually receive those treatments from Ayurvedic hospitals. Ayurvedic hospitals have been established in your areas by the government. You can get the medicines, but most of people don't go. Most of people don't get the maximum use of them. You see, Anne. Yes, but it is for the homeopathy. Listen to me. That is called homeopathy. Homeopathy ka never done. Homeopathy ka no what? Within Ayurvedic hospitals, they are very famous Ayurvedic hospitals. Very famous all over the country. In Colombo also. I think we can get the medicines also. But I also like to get the Ayurvedic treatments. I also drink Ayurvedic porridge. Yes, Ayurvedic porridge. But unfortunately, we always take only the Western medicine. Western medicine is not powerful. It is actually not permanent. Not permanent. But Ayurvedic treatments are permanent. Permanent. I killed in Anuradhapura, in some areas, there are very famous indigenous Ayurvedic doctors who have old systems, secret systems. Now let's talk about water supply. One student told me that we haven't completed water supply. Isn't it? Yes, there. And Anidu? Abude, to me. Haven't we done that? Completed the water supply. But I gave you the reasons for the requirement of supply of water. So tell me, Ujani, Abude.
Sir, we did that.
Sorry?
Sir, we didn't do the name, the staff of a religion office of the water board, the page number 4.
Have we named? We have to name.
Yes, sir.
I name Karam. Yeah, on engineers there. Engineers. On there are some officers in charge the duties on. Then there are plumbers. There are laborers. On laborers. Laborers. Okay, Bute. Laborers. Laborers. On Bute. Penavade. There are meter readers. On the meter readers. Staff in a regional area office. In an area office. There are engineers, there are some officers in the office, and clerks, plumbers. Plumbers. The real sound is plumbers. Plumbers. Laborers, to work hard. Meter readers, on telephone operators line, computer operators line, but don't write them. You write the main jobs. Meter readers, plumbers, laborers, engineers. Main jobs we are learning about public services one by one. Next week we can talk about education and security services. cooperative movement, very important. And geography also there. We are going to discuss geography next week. Today, nowadays it is very cold. You know why? We can talk about that next week when we talk about the planets and the asteroids. I will show you that video also. How this earth becomes or becoming colder day by day. Till August, we don't know whether Sri Lanka will be a cold country in future. The planets will That's all for today. Enough. You worked hard today. You wrote a lot. And I think you are happy. We are going to meet again next week with geography. And bye. See you. God bless you.